closer towards some kind of social revolution that will demand change in the true democratic style. I am not quite sure what to say now. I'm sort of not used to this. I want to just thank the people who've funded the work that I'm going to present today, and without whom I think I would almost certainly be stacking shelves at HEB in Texas, and in particular the Johnson Family Foundation, who have made Thoughtful House a viable entity. I want to talk today a little bit about, I want to present some new data, which is the culmination of a 5-year project that we've been undertaking with the University of Pittsburgh, a collaborative program looking at aspects of vaccine safety. And just as by way of background, I came across this the other day. I was sent it by a great friend of mine, the National Immunization Program Strategic Plan up to 2005, listing their priorities for vaccine work. And you can see that they give vaccine safety really a very lowly priority, putting it in fact just above a happy working environment at the National Immunization Program. So if you were going to put the precautionary principle first, as one should, then this really doesn't cut the mustard, as we say in England. Perhaps I'm being unfair. Perhaps I'm actually being unfair, and they accord vaccine safety far more importance than I am suggesting. So let's just take a little look at that. And this is the World Health Organization recommendations to vaccine manufacturers in the pre-licensing studies. Before these studies go into children, in an experimental setting, they perform safety studies in primates, non-human primates. And that is because they are our closest cousins and have many biological and physiological processes that are very, very similar to our own. And so the recommendations for the vaccine manufacturers are as follows. They recommend using no fewer than 10 primates, and rather than giving the vaccinations subcutaneously or intramuscularly, they are given directly into the brain, directly into the thalamus of the brain, which is perhaps somewhat unusual. It's not even the vaccine itself, but the vaccine antigen. So, for example, for measles vaccine, it's the measles virus, but it is not any of the other components that make up the vaccine. So they are not truly testing the vaccine in any shape, manner, or form. So the animals are then observed for 17 to 21 days for evidence of neurological abnormality, at which time they undergo necropsy, and the brains are examined under the microscope for evidence of damage. Microscopic evidence of damage. The problem is that there are no unvaccinated controls required by the World Health Organization, no animals that receive saline injected into the brain, and therefore it is not a scientific experiment. The data, the results are uninterpretable. You cannot tell whether the damage is due to the measles virus or the injection itself. What is alarming about these studies is that if an animal dies in the first 48 hours, he can be replaced in the study. It's not the vaccine's fault, it's the animal's fault. And if more than 20% of the animals die during the course of the experiment, you can scrap the whole experiment and start again. Once again, it's not the vaccine's fault, it's the animal's fault. And so you begin to see how ludicrous this whole situation is. And this is what happens before the vaccines are put into the pediatric population in an experimental setting. The idea that you would test the combination MMR vaccine is anathema. That has never been done in this setting, at least not in any published form. And the other important thing is that clearly vaccines are given to infants for the most part, and age of the primates in these studies is not specified. They do not require that they are given to infant primates. And age, just like size, I'm told, is important. Now, why is age important? Because the response of the immune system, in particular to infectious agents or foreign antigens, is largely age-dependent. Let me give you an example. If you get measles when you're 5 to 10 years of age, you will deal with it. It's a mild infection for the very, very most part. But if you get it under the age of 1, the outcome can be very different, because you handle